All right, let's talk about first trimester screening tests, what to expect, what labs are they going to draw, what ultrasounds are they going to do for genetic screenings. Here we go. The first genetic screening that's done through ultrasound is the Nuchal translucency test. This is done between 11 and 13 weeks. Then we have a bunch of blood tests, the NIPT, and then also the initial labs that you do in pregnancy, usually at your first or second OB appointment. They call it a prenatal panel. So it says a blood test that includes a complete blood count, which is CBC, blood type and Rh factor, and screens for infections like hepatitis B, syphilis, HIV, and rubella. First trimester screenings, a combination of blood tests and ultrasound that screens for chromosomal disorders and heart and birth defects. And then they're gonna look at your anemia, then cystic fibrosis and spinal muscular atrophy. And now the next step is to do the glucose screening. It says a glucose challenge test to measure blood sugar levels, a glucose tolerance test to measure blood sugar levels, which is often performed between 24 and 28 weeks of pregnancy. This was my little baby girl at our Nuchal Translucency, and they wouldn't really let me record, but I snuck a couple little shots in there. According to the screening, everything went really well. It was so amazing to see her on ultrasound, and luckily they were able to see everything they needed to see, and it looked like she was measuring perfectly, and there were no abnormalities. There's a few screenings that they can do in the first trimester, and one of them is the Nuchal translucency test. This is an ultrasound that's done between 11 and 13 weeks gestation, and it's really important that you do it within that window. Otherwise, they won't do it, because I guess after 14 weeks, that fluid that's behind the neck, and that's what they're measuring for, is actually reabsorbed, and it's way harder to measure. So it has to be done between 11 and 13 weeks. So they're gonna look at what's called the Nuchal fold, and it says a Nuchal translucency scan looks at the space at the back of the fetus's neck, called the Nuchal fold, when the fetus is between 45 millimeters and 84 millimeters from crown, the top of their head, to rump, the bottom of their torso. The idea around doing this test is that they say that there's more fluid that builds up behind the neck when a baby has some kind of genetic disorder or chromosomal, I can't talk today, abnormalities. Sometimes this can indicate that baby might have Down syndrome, which is trisomy 21, or Edwards syndrome, which is trisomy 18. If baby has abnormal fluid behind their neck, it can also mean that they may have a higher chance of having congenital heart defects. They'll also likely do the NIPT, which is a blood test where they draw like 10 tubes of blood, and then they'll screen for all kinds of genetic conditions. This is the test that everyone wants to do too, because you can do it at 10 weeks, and this test helps you determine the sex of the fetus. So you'll be able to know if your baby is a boy or a girl now through a blood test at 10 weeks called the NIPT. I'm just gonna read this to you real quick because I don't wanna summarize it incorrectly, because the mother and the baby's blood do not mix, but this is how they're actually able to see like fetal DNA in the mother's blood. So it says the NIPT analyzes cell-free DNA in the pregnant person's blood, which comes from the placenta. The DNA in the placental cells is usually identical to the DNA of the fetus. I did these labs a while back, so I'm just gonna read you like everything that they screened me for when I did my NIPT test. So they screened for trisomy 21, Down syndrome, trisomy 18, Edwards syndrome. They screened for trisomy 13, Patau syndrome. They do, of course, the fetal sex, so you can determine the gender. They'll screen for Turner syndrome, Jacobs syndrome, Klinefelter Syndrome, and I don't know if I said that correctly. And then something called XXX Syndrome, where there's 3 X chromosomes. And then they'll do a cystic fibrosis panel, which is called the Cystic Fibrosis 39 Variant Panel Report when it comes back. And then they'll screen for spinal muscular atrophy. And when that comes back, it's called the Spinal Muscular Atrophy Report. I did an entire video just on like my labs that I've done in the first and second trimester so far. I'm actually today about to go and do my gestational diabetes screening. I'm doing a non-fasting 1-hour glucose test, and that just screens for gestational diabetes. and I'm filming that whole experience. I'll try to link it here if you're interested in seeing how that goes. I also kind of did like a vlog style morning videos to show you like what I ate, and I just talk about how it's so important to go through like your normal routine of what you would normally eat in the morning, because the test is meant to screen you for gestational diabetes, and if you don't pass the test, that means that you're not controlling your sugars. So the goal is not necessarily to pass the test. Like, it is the goal to pass the test, but you don't want to just like pass it if you're actually not controlling your sugars. So you don't want to like do things to pass it. You want to go about your normal routine. That way you know, like, are my sugars controlled or not? Because if your sugars are not controlled, it can cause so many issues in the labor and delivery process. I'm a labor and delivery nurse, and it happens sometimes where people actually do have gestational diabetes and somehow they got through their screenings, and then it causes issues with baby in the delivery. So we're going to be filming that whole process on the gestational diabetes screening and how that goes. But back to the labs in the first trimester. So at my first OB appointment, they sent in for a bunch of labs. One of them was the genetic screenings, the NIPT test, and that was a blood test. And then the rest of them were just like regular prenatal labs. And so I'm just gonna real quick go over what labs they drew. So they're gonna essentially screen you for every disease possible that you could have. Hepatitis B, hepatitis C, hepatitis A. They're gonna do an RPR, which screens for syphilis. They're gonna do a GC, which screens for gonorrhea and chlamydia. They're also gonna do an HIV screening. They're gonna do a complete blood count, which looks at your white blood cells, your red blood cells, your hemoglobin, your hematocrit, your platelets, and then they're also gonna look at your blood type. They're gonna see if you have immunity to rubella and varicella, and all of that, they call it a prenatal panel. So it says a blood test that includes a complete blood count, which is CBC, blood type and RH factor, and screens for infections like hepatitis B, syphilis, HIV, and rubella. First trimester screenings, so that's kind of like all the things that we already went over, a combination of blood tests and ultrasound that screens for chromosomal disorders and heart and birth defects. And then they're gonna look at your anemia, then cystic fibrosis and spinal muscular atrophy. And they'll do these tests usually even if you don't have a family history of these things. And now the next step is to do the glucose screening. It says a glucose challenge test to measure blood sugar levels, a glucose tolerance test to measure blood sugar levels, which is often performed between 24 and 28 weeks of pregnancy. I went to my 24-week OB appointment and they put in the labs for my glucose test then. I'm now 26 weeks pregnant and I still haven't done it. So I'm gonna do it today though. We're doing it today. So as soon as I get the results back for my glucose screening, I promise I will share them with you. All right, guys, I gotta go. I gotta get this glucose screening done. So I'll see you in the next video.